All right, welcome everybody. Today we are here for this another brief 15-minute LinkedIn chat. We are talking today about the topic of decoding workplace wellness. It's going to be a fun little chat. If you don't know me already, my name is Emma Carpenter. I am the corporate wellness strategist at 12 Weeks to Wellness. I've worked in corporate wellness for over 25 years. At 12 Weeks, we work with organizations on creating healthy workplaces through wellness coaching and services. Coaching is our primary business, has been for over 25 years as well. We have an amazing team of certified coaches and dietitians that work with us. Today, I am thrilled to introduce my guest, Dr. Mark Attridge. Mark has over 25 years of experience in workplace health and employee assistance program services. He is an expert on measuring outcomes, ROI, and best practices in integrating employee assistance, work-life, and wellness programs. He is the author of 40 peer-reviewed scientific papers and book chapters and over 200 trade articles, conference presentations, and trainings. Welcome, Mark. I am so excited to have you here today.
Hi, Emma. Thanks for having me. And thanks to Charles Curtis for connecting with me many years ago in Canada, Vancouver, and been kind of working in Canada and the US now for about 15 years. So I'm happy to talk to you today and to answer questions that people have.
Yeah, it's a fairly small world, this wellness and health area. So I'm just trying to let people in here as they come in. Hopefully I'm not missing anybody. So this session is recorded. We're going to try to keep it brief, and we just talk about a few key questions here. And if you have any questions, feel free to pop them in the chat. We'll try to get to them afterwards. And if we can't, we'll follow up with you afterwards for sure. And if you have any questions, please put them in there as well about anything else. So workplace wellness programs have really existed in some shape or form for a really long time, actually, like since 1800s, but then mostly focused on safety and exercise for factory workers, etc. And then we started to get more smoking cessation programs in the 70s. But Johnson & Johnson was probably the first company to tie wellness programs to productivity and profitability in the 80s. The fact that the 80s is 40 years ago is now I'm still not comfortable with that. I feel like it still should be 20 years ago, but it is. And so it has really changed over that time as well about how much focus we put on that profitability and ROI versus just doing a good thing for the workers. And over that time, we've learned a lot. We've learned a lot about what it really takes to make wellness programs successful. And there's honestly a lot of reasons for why a wellness program sometimes don't work in terms of improving well-being. And every once in a while, there's a study that gets a lot of press around it. And we have one right now that came in the beginning of January. There's been others in the past. And so I wanted to bring Mark in to shed some light on this, the general sort of research in this field. What do we actually know about the profitability of this? And in particularly, maybe this particular study by Fleming that came out in January. So Mark, can you shed some light on this?
Yeah, sure. Thanks, Emma, for the introduction to the kind of research history. I do want to alert people to the LinkedIn announcements for this talk has 3 different sections where I've kind of posted the top 5 links to other resources, research papers, the Fleming study, and a critique of that study that my friend Paul Terry wrote at the American Journal of Health Promotion, and just some of my comments and some papers I think are relevant to these 3 topics today. So people can go learn more about these things in depth from the direct research sources, which I think are always useful to get a little more detail. But the study by Fleming is a young researcher, kind of new in his career over in England at the Oxford Center for Wellbeing and Health, and they have a lot of great researchers there. They were commissioned by a major employee organization in 2014 and 2018, I believe, to do a 2-wave study of tens of thousands of employees in hundreds of companies. And they ended up getting over 46,000 employees to tell in a one-time survey about their workplace from over 230 companies. And so it's a big study, lots of employers, got a lot of attention. It got published in a peer-reviewed journal with a lot of good details. Got picked up by the New York Times, The Guardian in the UK, Forbes magazine, HR magazine, Financial. A lot of places covered it. It was all over LinkedIn, for instance. I immediately read it and started posting a bunch of critiques of the idea of the paper was, well, if we asked people, did they use individual wellness, mental health, stress kinds of programs? And they actually listed 90 different programs just with a couple of words and said, did you use this, yes or no, in the past year? And then they had other really good things about your health and your wellness and your different risk indicators of mental health and overall wellness. And if they, worked with their company, what they thought of the company's culture, a lot of good measures. But then they made the illogical assumption to say, well, if I'd used this in the past year, which only like 1 to 10% of people even use these programs, that then would link to their same state of health being better or worse, which of course makes no sense because you need to use a program when you're in distress. You need to follow someone over time. You need to measure if the program had fidelity and was effective and delivered on what they said they did. And then you measure longitudinally, do these symptoms and risk factors about the person, about their work, about their company change over time, before and after using an intervention, and preferably find a matched group of people who are also similarly distressed but didn't use it. And there's many, many studies that do that. I provide links to studies that do that. We just did a study in the US of 85,000 people that had longitudinal data over 7 years with CureLink EAP, and their coaching and EAP counseling was effective over time. And that's kind of how you do a real intervention study. And we had large statistical effect sizes. So this particular study got a lot of press for saying, oh, wellness programs don't work measured in this particular way, which is basically irrelevant to how you assess these. And so I'm surprised it got so much attention, but I think it's just because the headline was so salacious of, 50 years of wellness actually doesn't work. And it came from a very prestigious place. But if you actually read this person's article, they said all the things I just said in their own study. It's just the journalists didn't mention any of that in their press coverage. So it's really not the fault of this particular author, because he did a good job, a good science job in it, and is very careful and critical of his own work. And it has some strengths about, the workplace wellness culture is very important. And these 233 companies really differed a lot in how much they actually supported workplace wellness, which is kind of the main point. But from a layperson perspective, or just someone reading LinkedIn, this headline is kind of like, what the heck, And so I think that was interesting and a point worth mentioning of, well, you really need to dig a little deeper when you see these kind of headlines.
Yeah, for sure. Yeah, and I think he was pretty clear on that there was some bias involved in as well in there. Okay, so knowing that, then that we know that there are lots of reasons for why it may not work, and there are good and bad ways of measuring this, and particularly to really get to the to whether this is working or not. But what do we know then about what really makes a successful workplace wellness program now? What have we learned?
That's a big picture question. Again, my friend Paul Terry at American Journal of Health Promotion is the editor, and that was the end of his critique too, is that, wow, I wish this study would then lead to better studies that get at not just to individuals who need services, use prevention or use acute care like counseling from an EAP, or do they change their lifestyle, through diet or wellness or stress or other kinds of kind of more longer term lifestyle change. But more importantly, does that individual focus, which is largely an American emphasis and perhaps somewhat a UK emphasis, complemented by the management and the leadership at a company that wants to provide benefits, wants to provide a whole range of health and well-being services every day of the year and promote it so that people change the culture to feel it's okay to eat healthy. It's okay to take a break and exercise. It's okay to tell your boss, boy, I just can't cope with all this stress, or it's okay to get help for something going on at home that's distressing in your marriage or your family. And I know that works because there are many examples of internal EAP programs that have full-time staff at big organizations, universities, hospital centers, big corporate, global clients. And they typically have almost double the utilization of counseling and other kind of acute care services than programs that hire out a company and don't necessarily promote it as well. The company doesn't necessarily know it's available, or they don't trust it. And so we know that kind of having trust with employees and especially having managers trust the service to make referrals, is really where it makes the culture okay to do these things. And the Health Enhancement Research Organization has what they call a scorecard that they developed with Mercer. And it lists all these manager and business, HR, company policy kinds of things. I believe there's 9 dimensions you can score your company on about, are you doing workplace wellness? And they did a couple of studies, 2 of them got published, that said of the hundreds of employers that have taken this scorecard, and again, just one person completes it for the whole company. It's not an employee measure. It's what's the company doing to promote wellness. And the companies in different industries that do more of these activities, these business-sponsored activities, actually perform better in the S&P 500 and stock market. So it's not just that this is good to do to help your employees, help your managers. It actually makes companies more effective and more profitable. So putting the onus on helping the worker is a good start. But to make these things work, you really have to help the workplace and do training and education and promotion. And that takes more work and frankly, more budget. And some companies aren't prepared to do that as much as other companies.
Yeah. And there are interesting data about too as well that, there's so many organizations. I think 80% of large employers say that they offer wellness programs, but only about 60% of the employees are aware that it's being offered. Only 40% actually say that they use it. So there's a big discrepancy in the organizations feel like they're doing what they should and what they can in terms of this, but the employees don't agree in that is what they need in particular. So big discrepancy between there. I think there's also some good research specifically around how different types of wellness programs can support each other. For example, when we're looking at coaching, for example, that we do, we see consistently that there's good referrals between different providers as well. So if we work with a client on maybe it's about increasing their resilience to stress, or maybe it's about increasing their exercise, then the rapport we create with that client is going to make that client also more likely to actually utilize other types of services such as counseling, etc. So there's a benefit, and it kind of increases the overall effectiveness and uptake of other programs by engaging in these more rapport building, relationship building services such as, and that are more personalized, such as wellness coaching as well.
Yeah, exactly.
Now that kind of brings me to the other part, which is sort of the technology part. Then we're seeing more and more technology-based wellness companies that come into this area as well. And so what role do we think that's going to play going forward? And do we have research that looks at that relationship?
Yeah, this technology trends area is actually really significant for the field. And I've written a large number of articles and trainings for like the International Federation of Employee Benefits Plans and HR groups in South Africa and different places around the world. Brazil, Ireland, Japan are very interested in a lot of these services. And one of the things that we've been looking at in the Journal of Employee Assistance, I have a series of articles in the last year called EAP Evidence. And people can look these up for free in the Employee Assistance Digital Archive, University of Maryland. But these articles are surveys of the fields of professionals in EAP and some in wellness, over 100. And we asked them what's going on with these new kinds of technology companies that I call digital first companies. They mainly reach out to people through phone apps and website tools, and then employees can start these tools and engage them and try to use them. Most of them are for what we would call preclinical or non-clinical services. So you're learning about your symptoms. You're saying, am I normal? Do I need stress? Am I stressed? Do I have anxiety? How is my weight compared to other people? And usually about 1/3 to 2/3 of a company will try these kind of initial assessment tools. And they're a great door opener to learning about wellness, learning about mental health, learning about, relationships or other kinds of issues. The challenge is a lot of these companies then don't have much beyond that. They don't have connections and referrals back to licensed dietitians, licensed coaches. Virtually 100% of the companies that are buying these tools also have an EAP. I haven't heard of any of them that require referrals to the EAP once someone screens positive for anxiety or depression or stress. And so these are largely independent benefits that employers are buying to try to support, their whole workforce, which is really good. But the other research that's going on, and I've worked with 2 or 3 startup companies that made digital tools. that do cognitive behavioral therapy, where you have a lesson or 8 lessons on stress or smoking or diet or anxiety or phobia, and how do you get better. And we have published research showing that for the people that participate, more than once, they tend to get better at a small rate, not as much as talking to real counselors usually, but it has some benefit. But what's not in most of these peer-reviewed studies, because you have to have criteria to be in the study, you have to meet the guidelines of enough data, is that probably 70 to 90% of people drop out before they get to the level of use to be in a research study. And so a lot of the employers and purchasers, and frankly, EAP partners, are sort of confused about, well, do these tools and apps and websites really work? Because they all have some studies or some evidence showing they work or that people like it, but they don't show the front end that the majority of people all over the world in all different languages, different cultures, I'm a reviewer for many journals, the big finding is people don't like them and they drop out. But that's not what you hear in the marketing. People say, oh, we reach 70% of people, only 5 or 10% of people use coaches. We're much better because we reach all these people.
Right.
But reaching someone is different than using it enough to get a benefit, and especially a clinical benefit. And the reality is that most people in a 12-month period may not need any of these services. If you measure EAP use over 5 years, the average EAP gets about 20% of people to use the service, not 5. And so, you want to take care of your whole workforce on an ongoing basis, not just at the startup of a new service that's promoted really well on email or text. So I think the technology area really should be looked at as like a Venn diagram of overlapping a machine or a robot or a self-care tool, which reaches everybody, is very cheap and helpful. It's mainly education, versus a live human professional coach or dietitian or counselor. And where do those overlap? And could counselors and coaches refer people to these tools to help track their symptoms, track their progress, encourage self-engagement? But I think just buying them by themselves alone and thinking they're a replacement is really not honest in the marketplace. And in fact, I wrote an article last year that got a lot of attention on LinkedIn, over 1,000 some people read it, of imposter EAPs and groups that don't really serve the workplace. They don't really even provide real counseling, but they provide all these tools that the person has to figure out how to use on their own, which is very appealing. But the evidence shows most people try it, and it's not, when I'm talking to you, Emma, as a coach, you can customize your response to me. We can create a game plan over the next 3 months of how to change my life. These apps and tools don't do that. They're not very dynamic. And so they assume each user has a certain constellation of features, and that's it. And so they're designed really well. It's just that people are complex. And so you need to talk to a professional coach or talk to a counselor to deal with your complexity. And then that's why, your results are about 85% of people get better. That's the worldwide result for counseling too. These other apps, if you figure into account, 60, 70, 90% drop out, their actual effectiveness is maybe 10%.
And I think also we need to sort of consider the personalization part of it, and that we are all different for sure, but also we're all in different stages of readiness as well, right? So there's going to be people that are just starting to think about it and raising their awareness. They may benefit from actually just going through a virtual experience and seeing where they're at and normalizing their experiences, absolutely. But we also we have a lot of clients that come to us that we spend a good amount of time in the beginning just creating the rapport, because these people just need to be heard before we can even get to actually making some forward action and movement, because they need someone to create that rapport with them, and that's something that's very difficult, obviously, to do with a virtual technology experience where you don't have that live person there. So again, finding people where they're at and really meeting them with what they need in that.
Well, another dynamic of the online and the phone app and the resource, and why people love LinkedIn or social media platforms, is because it's social. And some of my friends, like Dr. Joel Bennett with Organizational Wellness and Learning Systems down in Texas, he's done about 20 years of research looking at group level interventions for wellness and health and fitness and stress and all kinds of things. And he's found a lot of success in peer-reviewed published studies of when you can get people as a work team to engage around a similar topic, say for once a week for 12 weeks, or different programs that are similar to people. That's where I think the strength of technology can come into play, because people are already comfortable using their phone, using the internet. And if they find some peers online who are like them, And I know we wrote a book almost 20 years ago on integrating workplace wellness and work life and EAP. And a lot of the pioneering companies at that time, 20 years ago, were just starting to use bulletin boards at, Ernst & Young or something. And they found out that because of this email bulletin board 20 years ago, that a large slice of people were having issues with their parents aging and getting dementia and Alzheimer's, but they didn't know it because they didn't talk to each other. And so as a really big company, sometimes these technology tools can bring people together and make them feel more confident about reaching out to a professional or reaching out to a coach or a counselor. And so I don't want to say that the technology sides aren't useful, but they have certain components that are real strengths. And they also have certain dynamics that also are, unfortunately, pretty strong weaknesses too. And so I think a better approach is to try to figure out how you can use all of these things together.
Yeah. And really just offer a diversity of different options for people, because again, for some people, it's going to be their thing to be in a group and interact and work through together. And again, get that normalization experience. I know other people that will just rather not go anywhere near that. Absolutely. They would much rather just do it on their own with personalized support directly, and wouldn't set their foot in a chat room. So again, that diversity is so critical, and that we really find people where they're at. All right. If there are any questions at all, please pop them in the chat. Unfortunately, this is all the time we have. Mark, this was lots of fun, and hope everybody enjoyed it. If you want to continue the conversation, just please send us a message. If you have ideas about what else you want us to talk about next time or address, maybe Mark will come back another time and we can look at some more interesting research out there. It's always great to hear your insights on this. So thank you so much, Mark, for your time today.
Well, you're welcome. Thanks for connecting me, and good luck with 12 Weeks to Wellness and all the tools you provide to everybody.
Thank you. You as well.
All right. Take care. Bye-bye.
Thanks, you too.